Okay, we can start. Good morning, good afternoon, good evening, and thank you very much for joining another IWS Intermittent Water Supply Specialist Group webinar. My name is Razia Farmani. I'm the chair of a specialist group, and I'm going to host today's webinar. Thank you for attending. Please, if you have any questions, either type those in the chat or you can turn on your microphone at the end and ask your questions. It's my great pleasure to welcome today's speakers. We have a group presentation led by Professor Nayanatara S.Nayak. She is a professor at the Center for Multidisciplinary Development Research in Dharwad, India. She did her PhD in economics from Mangalore University, and PhD thesis was on burden of alcoholism. And she has done her master's and MPhil from Karnataka University, Dharwad. She has experience of conducting and guiding research in areas including health, environment, decentralization, water resources, tobacco control, and alcohol-related issues. It's my great pleasure to welcome her and other speakers. She will introduce other speakers during her talk. Over to you. Thank you.
Thank you, Dr. Razia. We are happy to make today's presentation on sharing of the findings of a study on transition from intermittent water supply to governance challenges and empirical outcomes. This is a collaborative study with US partners and CMDR, and we have a research team of Dr. Emily Kumpel from UMass, and Dr. Narayan Billava from CMDR, Dr. Aise Erkuman from North Carolina State University, Dr. Zachary Bird from USAID, Dr. K. Jayaramu from Water Board, Government of Karnataka, and Dr. Pushkarini Panchamukhi from RV University, Bengaluru, India. So this is the team, and the project was funded by USAID through the National Academies of Sciences. And the details of the designations and email IDs of all the researchers are present in the last slide. You can glance it. We start this presentation. And I am from Center for Multidisciplinary Development Research, a center located in Dharwad in southern Karnataka, southern India. And so it is an ICSR affiliated institute and recognized by Government of Karnataka. So we move to the next presentation. This is the agenda for today's presentation. I will start with background and relevance of the webinar. We move to the next slide. So this is the study area, the Karnataka state located in southern India. We have chosen Hubballi-Dharwad, Twin City, Belagavi, and Kalaburagi. The these cities were covered under pilot project funded by World Bank. So in 2004, the approval was given, and the piloting was very successful, and upscaling has begun. So we took these three cities in one group, and Mysuru City, which also tried to implement 24/7 under the government scheme, water supply, central government water supply scheme, and it started with the JESCO, a Tata company. But it was a failed project or uncompleted project, so we thought we should cover this city. And we also have fifth one, Ilkal town. It's the first town in Karnataka which has implemented 24/7 for the entire city, town. So we thought we should cover this. This has been funded under Asian Development Bank. So we have all the three types of financial resources, one from World Bank and the one from the Central Government of India and the other from the Asian Development Bank. So, and this is the coverage of the our study areas. And we move to the next step. We have an August audience here who knows what is IWS and CWS and its benefit. Just for the participants' sake, we have presented this slide, and you can see the photographs there. In India, we store water in tumblers, in buckets, and when there is intermittent water supply. So it's irregular, and the quality concern and storage is a major concern under IWS. Whereas in CWS, you can see it's the drink from tap water, and some households have been benefited by CWS, and wherever the pilot project is successful. And one more thing I wanted to show is the collection points. You can see the photograph there. Some of the IWS areas, it's not that everywhere India has such kind of locations, but in some localities, households have to collect water from the roadside where there is a public tap. So you can see that. So near the drainage, this public tap is there. So when people collect, households collect from there, there could be a chances of contamination. And you also can see a sump beside there where underground sump where water is stored. This also causes contamination, likely chances of contamination. Next, please. So just let me give the background and why we tried to join this webinar. Because in almost in early 20s, Karnataka particularly, most of the districts in Karnataka cities had a very acute water shortage problem. So urban local bodies or the municipal corporations were unable to provide water regularly. And so there came in the water board and took over the O&M of Hubballi-Dharwad city as well as subsequently other cities of Kalaburagi and Belagavi. And during that time, World Bank was funding most of the projects on water supply in other countries as well in India. So the Karnataka government approached the World Bank, and in 2004, the project the pilot project of three cities, Hubli, Dharwad, Belgavi, Kalaburagi, was started. And the success of this project in after 2012 made other cities also to follow up and upscale for the entire city. So for this reason, we thought we should take up this study as well as share our findings, because most of the cities and towns in Karnataka as well in India are trying to go for 24 into 7 continuous water supply, but without realizing the problems and transition in the resources, in coordination. So in that reason, we took up this study and we covered a sample of 6,700 households and three cities. We have 4,576 households. In Mysore, it is not the continuous or intermittent water supply. They have a different system, daily and alternate water supply. So daily for 2 hours they get water, and alternate they get for every alternate day. And Ilkal town, of course, has 24 into 7 water supply, and we did a small case study of 30 households to see the impact. So now, giving this background, I will request Dr. Pushkarini Panchamukhi to share the findings of three cities, the upscaling as well as the pilot project carried out with Dr.
Thank you,
Pushkarini.
Yes, I'm here. Thank you very much. So as you can see, and as Dr. Nayanatara already mentioned, the reason why we want to shift from IWS to CWS, pictorially depicted here, the kind of uh, discomfort in collecting water, the kind of health hazards that are involved in the IWS system. So therefore, the pilot was conducted. Can we go to the next slide? So here we are. This was the pilot, which was very successful. And there's a lot of detailed information on this slide. But what we can focus on is the coverage. So we, it's already mentioned, we covered three towns here, Hubballi-Dharwad, which are twin cities, actually, then Belgavi and Kalaburagi. And these are the first cities, in fact, in India to implement 24/7 or CWS on the public-private partnership basis. That was what happened. And as we know, this particular pilot began way back in 2008. And the success of the pilot gave impetus to make this, into a larger experiment and implement the CWS for all three cities, which happened much, much later in 2020. So can we go to the next slide? So here it is. This was transition from IWS to CWS post-pilot, which happened much later. So initially, it was the KUWSMP, which is Karnataka Urban Water Supply Modernization. And then the population to be covered now was 3 million after the pilot, which is a huge task. And you can see, as already mentioned again, World Bank, Government of Karnataka, and the urban local bodies, all of them were involved in this particular project. And the project cost, as you can see, was also shared among the cities in terms of the proportion allocated to each of them. What other details? Yeah, I think the others are all details which are there on the slide, just for information. We can move on to discuss the major empirical findings from the study. So let's focus on this slide here, where we talk about the per capita per day water consumption across the 3 cities under CWS as well as IWS. So we see one, that there is a positive relationship between water supply and water consumption, right? So we see that wherever for all CWS there is higher water consumption. We also see an interesting fact here, that higher LPCD among households with lower standard of living. That's shown in the other figure here, which shows, if you can see, we have lower income group, middle income group, and the upper income group. And we see that the lower income group is in fact consuming more, definitely under CWS, but also under IWS. CWS, you can see it's visibly more, and we try to understand why this is so. So some of the factors that we found out was there are a lot of households that share one tap so as to avoid or reduce their the cost, the billing, and share the billing, the cost of water among themselves. So that's how the consumption of water is higher. 2 is they also have fewer ways of storing water. So whenever there is, there's the tap is always on to for all their purposes, for all purposes all the time, because there's no way of storing. So you can see, we will see later how, these people with livestock and all of that, they're continuously using water without much discretion. And therefore, we see a high water usage among people from the lower income groups. Then we also see in the table below monthly water charges. And we see here that higher water charges are being paid by the CWS households. And of course, this is because we have a progressive water tariff. And you can see here, 1 second, can you just move back to that slide? Yeah. So we have in the table, we have something called as type of ration card. So in India, we have the system of giving or classifying people as per their income status, below poverty line, above poverty line, and you see something called Antyodaya or Akshaya, which actually represent a certain section of the society that is very heavily marginalized. So we are looking at how is their consumption. Okay, next we are talking about expenditure on water as a percentage of household monthly income. And here you can see, both under CWS and IWS, definitely under CWS. So see an interesting your chart here, consumer satisfaction, which clearly shows that under CWS there is higher satisfaction. And when we figured out why, it's not about the quality as much, or it's not about any other thing as much as the pressure, water pressure. So people seem to be very happy with the water pressure under CWS, unlike IWS. Then we see another chart at the bottom here on water storage at household premises. And there we can see that under IWS, obviously there is higher water storage, but what intrigues us is why is there storage even under CWS? So, under CWS also households continue to store water because they are uncertain as to when there can be disruption. Also, they already have sumps and tanks, like we just showed a few slides before, where they store water for use because the continuous water supply doesn't come into all the taps in the house. So typically what happens is water is stored in dumps or overhead tanks, and then from there it flows into the taps in, say, the washrooms or even in the kitchens. So that's how we see that even under CWS, people are storing water. Okay, let's move to the next slide. Yeah, this is an illustration of how water is stored under IWS in one of the sample areas. And you can see whatever they can lay their hands on. Yeah, please move to the next slide. Okay, now this particular slide is talking about some of the determinants of water consumption. And we took quite a few factors that could be influencing water consumption. And the first one was the mode of water supply, CWS or IWS, and then family size, whether the tap is owned or shared, poverty, house type, house size, ownership of livestock, like I mentioned before. So some of the findings are as listed here. Water consumption is higher among CWS consumers, which was expected. Family size, again, larger the family size, higher water consumption. Tap ownership, again, positively related. House type, which is, concrete or a solid house, which is also called as Pukka house. They consume more water, to mop their houses and stuff like that. Also means reflects to a certain level their income status. House size, also very, quite obvious. Households belonging to general category. So we have classified people into different categories in terms of their social background. So it's not about the income, but it's the social background. And general categories when they don't belong to any backward communities. And it is seen here that people from general category normally consume more water. With that, this is not shown in the table here. And households with buffaloes or livestock here, they consume more water. So we have all these variables significantly statistically significantly influencing water consumption. Though our R square, is about 40%, but that's indicating that the model has low predictability owing to large spread of data points around the mean. I've explained that in the paper in our article. Okay, let's go to the next slide. I think, so these are the final concluding observations. So 24/7 is working well in pilot area, but upscaling has been delayed quite drastically. So what was supposed to happen in 2008 went to 2015 and then thereafter to 2020. So that's the delay that we have seen. There is a lot of resistance from farmers because the pipelines go into their field. So they are not being paid anything for that. So their cost compensation has not really happened. Storage capacity is being enhanced now. And now this is the new deadline, 2025, but less than 50% of the work is completed, which is it's not a great news. Okay, so then next slide. Yeah, I think we're done now with these three cities. Now over to Dr. Narayan Billava, who will now talk about Mysuru City and what has happened in this particular city. It's another story. Thank you.
Thank you, madam. You already explained, Professor Nayanatara S.Nayak explained about this methodology of the Mysuru City, how many households we have selected, and also for the studies. And this study is focusing on Mysore. We all know that these cultural cities, and hence that central government is selected this city for the 24% water supply. Belagavi, Kalaburagi, and this Hubballi-Dharwad, these all are comes under the northern Karnataka, but Mysore is a southern Karnataka, comes under southern Karnataka part. Mysuru City Corporation with the Karnataka Urban Water Supply and Drainage Board formed a new project in the remodel of the entire water distribution network of the city. This is this project is approved by the government of India, but the other three cities approved by the World Bank as well as even ULB. They shared 30% by the ULB and 70% by the World Bank funded agent. But this Mysore is special cases. 90% is given for 80% is given by the central government, 10% is from the state government, and 10% is from the Mysore city corporations. The Jamshed Utility Services Company Limited, JESCO, a Tata Group is back the tender for the 6 years, 2009 to 15. The JESCO failed the extent of the 24% entire cities had the problem from the beginning because that time there was no elected body in the cities. Hence, another also there is not that much of cooperation from the even public also that time. Connected only 52% house services connected to the new systems, and only 17,000 household had a water supply for 24% water supply in the short period. Currently, 2 to 3 hours only providing water supply to some areas. In some areas, alternative days they are using the water. And in the 2015, that again MCC withdraw the contract from the JESCO. Again new after 2015, that Ireland FS, that infrastructure leasing and finance services, has taken a new vendor, and Mysore again it is again got the problem. Hence Mysore Vani Vilas water supply work, it has taken work from the 2019. These all are finding from this our studies. Almost all water consumption is higher among the high income groups. So also water charges also high in the higher income group. You can see that liter per LPCDs almost all similarly even BPL ration card and even Antyodaya. These you are considered as a poverty line, below poverty, above poverty line, like that. But though almost all they are using same water LPCDs, not much variation in the water usage and daily and alternative day water supply, because almost all they are receiving same water supply, and 1/4 of the household have not paid water charges. You can see here 15% percentage they never paid the water bills from the beginning, and even though 8% they not paid the water bill. So altogether 25% of household they never paid the water bill so far. Average water charges according to categories wise also, it is almost all liter 19 rupees, 20 rupees, 24 rupees, like that. And Mysore obstacles in the implementation is mismatch between the estimation against the actual. What JESCO has done, JESCO has proposed 17,521 household connections, and also it 1203 1,203 kilometer pipe network against. Actually, it is required 1,75,000 household connection, and also 1,900 kilometer pipeline. Hence, it is a mismatch between the estimation as well as actual. And proposed cost also. Even they proposed, JESCO was proposed 162 crores rupees, and against the 200 12 rupees is required, demanded by the JESCO later. And the existing problem is almost all net revenue water is more than the 50% in the Mysuru cities, and also 80% household, they don't have non-functioning meters. They are having non-functioning meters, and also 31%, 34% households are unauthorized connections. Only 85% city covered by the piped water systems. Lack of the active involvement of the elected leaders and the communities. We also observe in the field also this is opposition and non-cooperation from the public due to the lack of awareness, doubt about the privatization and assumption of higher water charges. And now, even though reluctant of the Mysore Vani Vilas Waterworks employed to work under the JESCO, they made it like that. That's what it is. Free supply of the water under the king's rules. Earlier, kings was ruling. You know that is Mysore Maharaja Wadair. They are ruling these cities. Now they are getting free water. Then people also tell them why we need to pay now itself, because then huge funding arrears also it is there still now. And uncertainty in the review of 24/7 water supply. In the case of complaint against JESCOs, the first private operator for the income completion of the work as per the contract in the filed in the court. Even second also, decision regarding the uncompleted project by the IL&FS, this is also is in arbitrary. No initiative in the resumption of the work now. More than 200 crores rupees lie invested for the 24% water supply project. It is useless now itself, because they are not able to give the 24% water supply entire cities. Even though they have full of water, like Kaveri rivers is flowing through the Mysore cities, they have a water, sufficient of water, but they could not provide the water to households. Currently, Vani Vilas water supply functioning body of the MCC continue to look after the water supply in the city as before. There are still uncertainty in reviewing of the 24 water supply in the Mysore. Thank you. Nayak, hello.
Okay. Hello. Thank you, Dr. Billava. So I will continue with a small narrative of Ilkal town. We have very short time, and I'll try to be very brief and continue with this. Please, next slide. So as I said, Ilkal is a very small town in Karnataka, and it is the first town in Karnataka to implement 24/7 to entire city. The first town. Not even a single city has covered 24/7 in India, in Karnataka, but Ilkal has done this almost a decade back. 2012, they implemented this project with the help of Asian Development Funding under Asian Development Bank under the North Karnataka Urban Sector Investment Program, NQ. So the objective of our study was to look into the facilitators of the study and how the project is being sustained. So we followed a small case study of 30 households and key informant interviews with the elected leaders, municipal councillors, commissioners, and the public and the engineers and the officials of the parastatal bodies and the private operator. Next, below. So just I have given here some parameters of before and after the 24/7 being implemented in Ilkal. You can see that the source remains the same, the Krishna River, whereas the supply from 3 to 8 days and even 15 days, now it has come to daily supply, and the water losses have been reduced from 50 to less than 10%. The water supply has of course increased because of the house service commission, and you can see that we had 67 LPCD earlier for the non-piped connection like borewells, those who use river waters or lakes. Now the average has come to 132 LPCD, and for pipe connection, of course, 132, and house service connections have 4 times increased. Next, please. And you can see the metering. Now it is 100% metering in Ilkal town. whereas compared to 54% earlier. And now there is automatic reading and spot billing instead of manual and time consuming that was done earlier. And the water charges, if you can see, we had INR 116 earlier, but now if you can see, we have for the low income households INR 155, high income it is INR 311, and the average is INR 203. So this is the earlier they were paying the lump sum for the whole year, but now it is based on the consumption. And for the poorest, we have the INR is 56 up to 8,000 liters. So the tariffs are progressive and inclusive. Water pressure, of course, has increased from 2 to 3 meters to 7. And then we have marginal arrears, almost nil, you can say, and consumer complaints are also have reduced. So Violia was looking after till 2023, and now we have the Padmavati and company as the private operator. Next, please. So, if you can see how this the system or the project is being managed, so you can see that it's being managed through the O&M, that is water charges. The whole O&M is dependent on water charges collected by the customers, and almost around 25 lakhs INR is being collected every month, and it goes for the private operator. Earlier it was Violia and the water board for bulk supply, and the remaining 20% is used for meeting additional pipelines extension works. But of course, you should see that in the sustenance part, annual charges of electricities, they are not met from the water charges. So Ilkal is unable to meet these charges from water user charges. Of course, they use the state finance commission grant for paying the electricity charges. So that is also one concern. Maybe in the long run, they have left to meet these costs through the O&M charge. And the average INR for this one is per 1,000 liters is 10 for the average, and for poor it is 7, and for the high income groups it is 12. And in the sustenance part, the Ilkal follows both no free rider policy, and for the schools and elementary schools they have some subsidies or the relaxation. But all the schools, households, offices in the town have cleared the arrears and they pay water charges regularly. If the households delay, then there is 1% interest charges. So this is how the project is sustained. Next, please. You can see the average LPCD is almost nearer to the benchmark of the Government of India Ministry 135 LPCD, but we can see that middle and low income groups are consuming lesser water. And you can see the tariff there in the next slide. This progressive water tariff. There is a 33% rise in water charges for the middle and low income groups from what they were paying before 24/7. Whereas it is 168% rise for the high income groups in CWS, which is a progressive tariff and inclusive. Next, please. So just putting the impact, we see the households are happy with the 24/7 water supply. Earlier, children and women used to carry water in water carts, but now they get the water at their doorsteps or in the kitchen. And ADB reports and studies show that there is increase in enrollment and reduction in waterborne diseases and increase in the income of laborers. But that needs to be documented by a scientific study. That's what our observation is on this. And the facilitator, as I said, Ilkal town 24/7 is successful because of the initiative of the local leader. He took the initiative, which is not seen elsewhere. So he visited other sites, Gujarat, Karnataka, Hubballi-Dharwad, and then based on that, he initiated this project and also provided water supply by constructing new jack well in the reservoir. So this is how it was being sustained, and it is successful. But of course, for the future, we have some concerns that need to be addressed. And there is water supply is enough and is regular, but there is power interruption. So every month there are frequent power interruptions. So other projects also need to consider this. And there is inadequate supply to some areas in the high lying areas. And increasing costs, there are increasing costs, but if you see the water prices which were levied in 2012 have not been enhanced. The same tariffs continues. So there is no increase. So it is stagnation in water charges, and the private operator is asking for higher charges, O&M charges, and there is irregularity in payment of AD billing. And of course, we need a storage to be improved and standby during the power failure. So, and also residents still they collect from the roadside, so there is likely contamination and also contamination during storage. So these concerns need to be addressed if the Ilkal town 24/7 has to be sustained. Next. So this is just a glimpse of whole Ilkal town. This one I have given it for reference. We can move to next slide, and Dr. So now I request Dr. Emily Bell from UMass. She is associate professor there, and she is partner in our this project. So I request her to present some findings from the water quality analysis.
Great.
Please,
Thank
Emily.
you. Thank you, Dr. Nayanatara. Great. Next slide, please. So previous studies of intermittent supply and compared to continuous water supply, both in Hubballi-Dharwad and in other places, have shown that water can be more contaminated in intermittent supply, particularly because of the loss of pressure and also from some of the poor quality materials that allow for intrusion of contamination, and then also consumers storing water. And so some previous work in Hubballi-Dharwad that we did had showed that there was better quality of water in the pilot CWS areas than in the intermittent supply areas. As part of this study, water samples were collected from household and public taps in the three cities that were discussed. And next slide. And also information was collected from households on their satisfaction with water quality. And so overall, there was higher satisfaction with water quality in the continuous supply wards compared to the intermittent supply wards, although satisfaction was quite low in Kalaburagi city because there were problems with the source water, higher dissolved solids, hard water, higher turbidity in the source water, and that applied to both continuous and intermittent supply areas, although satisfaction was still much higher for the continuous water supply areas than the intermittent in that city. But overall, the physical-chemical parameters were within the acceptable limits, according to the Bureau of Indian Standards information for intermittent and continuous supply. But also, even though water quality was not measured, information from households in Mysuru showed that many households were using home water treatment, reverse osmosis treatment, and a small percentage using some bottled water for drinking. And so there is even though there's been the effort to try to invest in the network, people are turning to household water treatment. And then the samples showed that by and large, most of them there were total coliform in some of the samples, although they were below the permissible limits. But in Mysore, there's also some challenges with some of the bulk water supply points and boreholes that have issues of water quality as well. Next slide, please. So I'll just be ending our talk to talk about summarizing some of the overall lessons that should be learned from all of these different case studies. One is, as was discussed earlier, the very first pilots that were done in the three cities in Hubballi-Dharwad, Belgavi, and Kalaburagi, that were done nearly, almost 15, 20 years ago now, were largely considered successful. And this was often because, well, it was a small population. It was 10% of each of the cities. There was a lot of attention and a lot of enthusiasm by all the stakeholders. So one of this, and this has come up, well, when I talk about the challenges with upscaling, this has been a problem where there hasn't been as much attention and enthusiasm and coordination. And with those demonstration projects, there was a lot of timely funding without any burden on the urban local bodies, and a lot of political and government support with communication and campaigns by the media, and a lot of coordination by the line departments. So line departments being everyone that needs to dig in the streets to lay infrastructure. So, we're thinking about water pipes, but there's also, digging that happens for railways and traffic and telephone and fiber and smart cities and all of this. And so there was a lot of coordination with the demonstration projects, but this became a huge issue for trying to upscale, where there was not so much enthusiasm, there was not so much coordination, and so that became a problem when upscaling. There was also sufficient water availability for 24/7 in the 4 cities, as well as in Ilkal town. And then also one of the things that was done with the pilot projects was that there was a steady supply of water with a separated an ELSR, an elevated service reservoir, so a separate service reservoir in the distribution system that was particularly dedicated for the 24/7 areas. And so they made sure to design the network in such a way that there was the adequate storage in the service reservoirs. And overall, CWS led to increased awareness by households about actively managing their water supply. The photo here is of a locked water tap, because the households were then charged on a volumetric tariff basis, especially if the taps were outside of the house. Homeowners would lock the tap so that way people, so that they could control how much water was actually being withdrawn, so children would not just open it. In the upscaled wards of Hubballi-Dharwad, they were paying more for lower consumption, so this is not the demonstration. This is when they tried to upscale the 24/7. People were then paying more for the water for lower consumption levels, and they were still facing frequent interruptions in supply, or still facing there's sort of a line between interruption and intermittency, but they were still facing a lot of interruptions, even though it was supposed to be upscaled 24/7. So they were definitely getting water less than 24 hours, even though this was considered an upscaled 24/7 area. And there's also been a lot of challenges in the upscaling with transferring responsibility of operations and management, operations and maintenance back to the urban local bodies. And so this is particularly a issue with the 74th Amendment to the Indian Constitution that says that basic services such as drinking water need to be the responsibility of urban local bodies, but because there has been private investment and involvement and private operators that are running 24/7, but then it's supposed to be handed back to the urban local bodies. But that hasn't always happened, and the responsibility of the assets versus O&M between them is still in question in many of the places. And also the upscaling was done in a hurry. Only the pipes were replaced, but the storage reservoirs were not necessarily, or they weren't reconfigured. And so that's led to some of the challenges with supply. Next slide, please. So some of the governance challenges, but also opportunities. With the demonstration projects, having concrete plans, accurate estimates, and discussions coordination were really important for the success of the project. And with the upscaling, this did not always happen, particularly with, as Dr. Narayan talked about in Mysore, but also in the other 3 cities, that there was not so much coordination, that there was a lot of delay in installing and in upscaling, and so that led to and a lot of other projects going on that challenged things. There was this gap in groundwork and organization and coordination, and particularly with the PPP, the public-private partnership models that delayed completion. So there's still multiple entities involved and mentioned between the urban local bodies and the private partners and the roles and responsibilities. There's many still, it can be very confusing in some of the cities about who's responsible for what. And also the withdrawal of the water board and then transition to private operator has been shown to be a very tedious process. And there's been a lot of challenges with the staff. Some of them moved on to be staff of the private operator, but some of them were laid off, and then there was some they're disgruntled or upset that then led to some problems within that transition. Next slide, please. So thinking about some of the ways forward, there's many that were discussed, but there's some thoughts of needing for backup facilities, particularly for the water supply, as well as we mentioned about thinking about the storage and the supply and storage within the cities. changes to the water tariff. Dr. Pushkarini and Dr. Nayanatara brought up many of the challenges with the current water tariff and arrears, and so there's some room for improving how that is done in the future. Also, the importance of consumer consultations and stakeholder participation cannot be underestimated. That was really important for the pilot, and that has been a challenge for the upscaling. And so continuing that sort of coordination is important, as well as, and then the settlement of many of the huge arrears that many of the residents have on water charges. So I just wanted to also highlight the importance of these upscaling, both the 4 different case studies, and so Hubballi-Dharwad, Belgavi, Kalaburagi, as well as the Mysuru and Ilkal case. There's a lot of focus on transitioning to 24/7 in India and many other places. And so these cities were some of the very first to actually try this transition on a pilot basis in the country. And so seeing the success of the demonstration project, but now many of the challenges that have come when trying to upscale to larger populations and more places is incredibly important as we think about lessons for all of the other cities and towns that are looking to improve their intermittent supply or transition to 24/7. And so this is the start of a lot of efforts on this. Next slide, please. So I want to say thank you so much for your time and attention, and to all of the people involved in the data collection and the funding from USAID through the National Academies of Sciences peer program. So we will all be very happy to take any questions. Thank you.
Thank you very much. A very informative talk and also very interesting project. So as I mentioned at the beginning, please, if you have any questions, raise your hand or put it in the chat so we can put those to the speakers. I don't see any questions at the moment. I can start with one. Sorry, is there any question?
No. I just wanted to inform that our other researchers, Dr. Jakari and Dr. Aise, have joined the discussion, so they are also there.
Yeah, very good. Thank you. So I was wondering, the leakage reduced from 50% to 10%. How much of the increase in demand was delivered by that reduction in the leakage? In the first case study, there was an increase in demand. For example, why was that happening? The improvement in equity, or was there any other reason? And then how that was delivered by additional natural resources or by that leakage reduction?
Can I answer that, Dr. Emil? So all the 3 cities we have mentioned in one of the slides, water supply is not a problem. We have resources. In the first slide, I have shown what are the water sources for each of the cities: Hubballi-Dharwad, Belgavi, Kalaburagi, Ilkal, and Mysuru. All the cities and towns have the water resources: Krishna, Kabini, Kaveri. So we have river source as the main source, and dams are constructed. So through the reservoir, water is coming. But earlier, the water leakages was mainly due to the leaks in the pipes, the quality of the GI pipes, which were rusted and which were dug and not repaired. So the water was flowing into that, and also there was contamination during that. But of course, the water board tried to give us the better water quality, because we have tested, as Dr. Emily presented, IWS and CWS. You can see the water, there is not much water quality differences. All the parameters are within the permissible limits. So they have treated it and provided. But the leakage was very high. And also we had these cisterns. In India, you can see the common cisterns were there, where you can collect the whole day. Water is available in the cisterns. So people collect there, leave the tap open, and that was also a wastage. So all that has been in the 24/7 or CWS, both in 3 pilot projects as well as Ilkal. all these cisterns have been closed. There is no borewell water. So everybody has to take the water from the piped supply, which there in the 24/7, they have the HPP pipes. The quality of the pipes has improved. Of course, there are some concerns in the news media that frequently within last 1 or 2 months, the quality of even the 24/7 pipes is not of good quality. So that has been tested. That has come up in the upscaling. That issue has come up in upscaling. But earlier, the old maybe 50 years of HG pipes, so which were rusted and which are damaged or not repaired. So this was one, and there was no metering. Metering was not there. So the illegal connection. So NRW was high because of the non-metered connections. So these were two reasons: leakages and this one. And of course, we had water supply. So source is there. We need to improve the storage, but we have the sources for all the cities. So if leakage is less, we can improve that. But in pilot project, you said question me about like how much was the increase. Pilot project was specific and the water supply was there. So they had specific area households and they supplied it. But in upscaling, it is still in the process. It is still in the process. We cannot say how much as of present, how much is the increase, how much is the water supply already provided. So that is still in the process. I said less than 50% work is has been done, and maybe they are telling 2025 the deadline, but already I saw in one of the World Bank document that is June 2026. I don't know when it will be again postponed date. So that is how. And Ilkal, of course, you said what is the increase in the enhancement of water supply. So there is 4 times increase in the water supply because the entire city has been covered there. That is
Great.
Maybe
Thank you
if I
very
could
much.
just add to that too. So I think something to highlight something Dr. Nayanatara S. did was the data collected was about the households municipal, the piped water consumption. People are also using the boreholes and other sources. So sometimes there's a shift. So maybe the people in intermittent supply might be using more water net, but only what's captured is only the piped water, the municipal water, not necessarily all of the other sources that they're using, the trucks and the boreholes.
Yeah, great. Thank you very much. We have a question from Andy, please.
Yeah, I mean, first of all, really illuminating presentations on some of the challenges from moving from intermittent to 24/7. I suppose one of the things I picked up there was particularly around the sort of NRW conversation was in a lot of those schemes, actually what the result is actually an increased pressure in your system. And that's not necessarily a good thing from an NRW perspective. Are you actively managing pressures, installing pressure management devices? Because that's been some of my experience over the years to say, actually, as you increase pressure, you make your NRW position worse before you actually make it better.
Dr. Emily, can you answer that?
Sure. So yeah, I think, well, one of the important caveats, and maybe Dr. Nayanatara, you can correct me if I'm wrong, but a lot of the pipes were replaced before doing the 24/7, at least in the demonstration projects. So there was a very high NRW. Then there was a lot of pipe replacement and new distribution system putting in. So there's 2 different things going on. So it's a little hard to isolate just the pressure increase. We don't have pressure data from the current cities. I know from when, at least in the demonstration zones in Hubli, from our previous work, even in the continuous supply areas, the pressure is not actually that high. Again, it's 7 meters at the connect of head provided at consumer points is the target pressure, and by and large they're not actually getting that much above that from some of the previous data that I've seen, maybe up to like 10 meters head, but it's not, these aren't like very high pressure systems.
Do you think do you think one of the challenges to scaling is the fact that actually to get to that position you have got to replace all of pipe? Because obviously that's the cost burden. So how would we do this in a sustainable way with existing distribution systems?
That's an excellent question. So, and I think that's the big question, right, that we all want to figure out. So So yes, I think that has been some of the challenges, right? So I think with some of these examples, some of them were full pipe replacements, some were not. I know there's been some other cities. I know Anand Jalikam, I know he's not on this, but I know he could probably speak to that, of some other places that this has been tried. But I think that is also a very important question. Some of them, right, Dr. Nayanatara, right, was it full pipe? There were some places that it wasn't full pipeline replacement, right?
Yeah.
In Ilkal and Mysore, how much of the distribution system, the pipelines, were actually replaced?
In Mysore, because it was around, I told 52% of the
Okay.
pipelines were restored there, but they didn't continue it because Dr. Narayan said in Mysore, the major problem started with miscalculations. While the project contract was signed, the pipeline that was proposed and the number of households to be covered was lesser compared to the actual requirement which the private operator did on their own survey. When they did the actual survey, they came to know that there is a lot more to cover, both in terms of pipeline and household. So that that was the issue of contention, and that's the way the project didn't start very well in Mysore. Of course, we had Tata company, Jasco. This is a well-known company, had done very good work in Jamshedpur, but only because of the miscalculations and not proper planning and management, the issue failed. That's all.
Okay, great, thank you.
We have a question from.
There is a question in the chat regarding it. Sounds like the transition to CWS in Ilkal town was generally successful and more opposition was encountered in Mysore. It also appears that there was a more progressive, forgiving mentality with tariff collection in Ilkal and more challenges with tariff collection in Mysore. Can any insights be drawn by contrasting the two case studies so that we can?
Yes, I can answer this.
We can address the challenges in Mysore.
Okay.
Yeah, please.
Can I go? Okay. See, Ilkal, as I said, it was a problem. The severity of the problem was very high because they were receiving water once in 3 days, 8 days, and even 15 days. I showed in the slide. And so water problem was there was a major problem. They had to get the water from 20 kilometers far away to the WTP, and they were depending on bore wells and river water. Whereas Mysore has a very good, from the very beginning, has a good system of water supply, which has been from the Vani Vilas Water Works, which was an agency even under the kings. They were Mysore, the king. So from that system, this system continues, and they are getting free water since then. And now, of course, they are paying, and some are paying, some are not paying, because that mentality of free water is engulfed in the minds of the Mysoreans. So but still they have a very good water system because of the river, Kaveri river, which is a perennial source of water for Mysore. For Bangalore also it is the source, but Bangalore, because of the distance, they face the problem from Kaveri. But Mysore doesn't face water problem. So that is the reason they are reluctant to pay the water charges. But whereas in the case of Ilkal, people needed it, people wanted it, and because of the elected leadership, which was took initiative, the whole system was planned within a short period. And the one main thing that the elected leader did was on his own initiative. The jack well was fixed in the middle of the reservoir where the water collection, so that the whole year the water is always collected in there. So separate jack well was constructed there, and then the middle of in the well, of course, they call it in the well. So this is the major reason for this. And of course, for Ilkal also, water prices are not very high. See, whatever for the last 10 years, they have been paying the same water charges. There is no enhancement in the water charges. So that is the reason it has succeeded till now. Of course, we have presented some concerns. If they are addressed, then that can be sustained.
Great. Thank you very much. I don't see any hand or questions. Thank you again for your very interesting talk. Thank you for all the participants attending. Just for your information, the recording of the talk will be available from IWS Intermittent Water Supply YouTube channel. And for those of you interested, we have also uploaded all the previous talks there, so you can have a look at previous talks as well. Thank you again and have a nice day. Bye.
Thank you.
Thank you.
We thank IWA.
Mm.
Thank you. Bye.
Thank you.
Thank you,
Thank
everyone.
you.